who recently received 5-star status. And so truly one of the best hospitals in the country, some of the best medical care in the country. We'll talk about what that means and what goes into that, what kind of proactive work goes into that. But first of all, thank you so much for joining me on Valley News Now.
Yeah, thanks for having me.
And so, Erika, first and foremost, just tell me a little bit about what you do for Sanford.
Yeah, so again, my name is Erika Brauner. I'm the quality manager here for the Fargo region of Sanford Health. Been with the organization for a little over 10 years, and a large part of my work and our team's work is helping to drive some of those quality improvement practices and performance improvement, and just really ultimately having these 5 stars being our goal, and that's really what our team is anchored in on doing.
Excellent. Well, let's talk about what that means exactly. 5-star status. How would you explain that?
Yeah, so when we're talking about 5 stars, we're talking about a CMS 5-star rating, and CMS being the Centers for Medicare and Medicaid Services. And so really what that means is it's a designation earned by roughly 8% of organizations that have their quality measures ranked. And that means that's about 8% of almost 5,000 hospitals, about 4,600 hospitals. And really we are ranked on our quality measures and our evidence-based practices. And so really what 5-star means is that we are providing that top tier category in a variety of different categories to our patients in our communities. And so really it's a high honor for us to achieve that 5-star status, really saying that we are providing the best of the best care to our communities.
And when it comes to 5 stars, I noticed that there's like 5 pillars in here. Now, does that work? Each pillar is a star, or is it just a cumulative thing instead?
Yeah, so there are intricacies into how the scoring happens, but to your point, there are 5 different scoreable categories, and that's going to be mortality, it's going to be patient experience, it's going to be our readmissions and how we're preventing those. It's going to be the safety of care, and then it's also going to be timely and effective care. So a lot of data is taken upon those different categories. There's different weights that go into it, but that's ultimately what produces our 5-star ranking.
Now, there's got to be a lot that goes into care. Just for a quick little side story, I used to work at a hospital in Winfield, Illinois. I was a transporter, pretty low on the totem pole early in my college days. But it was eye-opening for me just to see how much communication goes into effective care, how much organization goes into providing hospital employees with the right resources to be at their best day in and day out, which kind of leads me to the question of what goes into facilitating that quality of care at Sanford.
Yeah, I really attribute a lot of that to our journey in becoming a high reliable organization. And really what that means is it means that our people, our processes, and our systems are functioning as intended every single time. And really that sets up the patient for having exceptional care. It also sets up the employee for being able to provide that exceptional care. And really HRO, or high reliability, applies to everybody. To your point, non-clinical team members are just as important as the clinical team members when it comes to patient safety, how we're moving our patients through our system. And so a lot of that work to become a high reliable organization is really challenging ourselves to think, are our systems as best as they could be? What could we improve upon, and how could we enhance the experience of the patients when they're spending time not only in their hospitals, but in our procedural spaces or even in our clinics as well. And so really it's getting us to think innovatively, how can we use evidence-based practice to just continuously seek for improvement and continue to be that innovative leading healthcare organization.
So it sounds like there's a lot of kind of self-scouting, analyzing how is this going, how can we keep improving. Is that something that is structured through, I don't know, like people higher up in Sanford, like, hey, we're gonna have a meeting and talk about where we can improve? How does that work?
Yeah, there are strategic plans that our organization has that really kind of helps be, our driver in moving progress forward. But what we know is that a plan is great, but really what we need to do is engage our people in being a part of that plan and being a part of that change. And so recognizing we can't all be experts in everything, how can we pull those key stakeholders who are really at the bedside providing that care or doing those patient transports, bring them into the conversation and get their input and get their expert opinion on where we can make our improvements. And I think through that shared governance structure and through getting that input and really enhancing the employee engagement, that's been how we've been able to get to that 5-star status for our organization.
And when you drive by the main hospital, you see the helicopter pad.
Yeah.
And I think people know what that means. That means that people are coming in from a ways out for a lot of times life-saving medical care. And so just how big is that radius of care that you guys have, especially for emergency situations where someone might need to get flighted into Fargo?
Yeah, I mean, being the only level 1 trauma center, especially in North Dakota, you know, we take care of all comers from everywhere. And so sometimes we're providing care for patients who maybe their home address is over 200 miles away or somewhere close to that. And so it's really important for us to continuously innovate and be the best in our field so we can continue to provide that exceptional care, because we're not just taking care of Fargo, Moorhead, West Fargo. We're taking care of patients from Grand Forks sometimes, maybe Jamestown, maybe Grafton or Park River. So it's really how can we strategize and give the best care to the upper Midwest.
Now, I imagine that something like this, it's not about getting 5-star status. It's about helping the people, and but at the same time, getting that 5-star recognition, it has to feel good for you and your team.
Yeah, it's great. I think it's something that everybody should be very proud of. I think, you know, having the engagement that we've had with our teams has been pretty incredible. We are seeing enhanced engagement as we get further along in becoming a high reliable organization. So seeing that our patient care is exceptional and seeing that our employee engagement is also increasing, it feels really good, and it feels pretty special to be a part of it. And to be, you know, able to sit here with you and talk a little bit about the impact that we're able to make together.
Well, it sounds like it goes without being said, but when you're in the top 9% in the country, at that top 8.2, if we're really getting into the nitty gritty, something's going right. And so keep up the good work for you and everybody else who's a part of the collaborative effort that helps them reach that 5-star CMS rating. Before I let you go, is there anything else you'd like to talk about?
I would just say thank you for letting us be here today to visit with you about it. And I think maybe a couple closing remarks just in achieving that CMS 5-star status is, I think, really, as I reflect personally, again, it's something to be very proud of. And when I think about the impact that this has on our patients and our community, I think it really shows our dedication as a healthcare organization to providing that best care possible and really the high quality care and providing that best patient experience, And so I think that's my takeaway message, is it's incredibly great to be a part of this, and it's a great thing to have for our communities here as well.
Well, thank you very much, and thank you very much anyone who's watching at home or on your mobile device, however you are catching Valley News now. We always appreciate you tuning in. Have a great rest of your afternoon, and we'll see you next time.